Story, the COVID-19 vaccine. We have been listening to you. Many of you want the vaccine but can't get it. And the numbers show there's supply available, but experts say there's a problem getting shots into arms fast enough, and the state needs to fix it. 11 Alive's Paulo Suro breaks down where Georgia stands when it comes to vaccine distribution.
I'd love to see Georgia do better.
That's because right now, Georgia ranks 9th in the country for total doses delivered, but is close to last when it comes to vaccine allocation. So why this gap?
It's weird and a little bit concerning, actually, that the South in particular is struggling the way that it is right now, because it's us and Alabama.
That speed is just a real mystery to most of us. It's a combination of efficiency. It's partly the convoluted system for signing up for vaccinations.
According to the White House COVID-19 coordinator, since President Joe Biden took office, the number of doses being sent to states has increased by 28% to 11 million doses a week, an increase health experts say is necessary in Georgia.
What the state is reporting is that this week they update every Monday their allocation and request numbers. And this week our allocation went up 17%, whereas last week it went up 20%. So it actually went down in terms of the doses we're getting.
But experts say that we should soon see those numbers change as the Biden administration increases weekly shipments of the vaccine by 5%, sending some directly to pharmacies.
Bypassing the states, which I think is smart, because I think what we've seen throughout the entire pandemic is a lack of centralized control and centralized distribution. And so relying on the states to distribute the vaccines is relying upon their own internal systems, and Georgia clearly has inadequate systems.
It does seem like there's a little bit more strategic planning going on with this administration, and that's certainly welcome news to see, because I think that we've really lacked that at all levels.
A sign of hope during a slow vaccine rollout.